Welcome to this explainer. Today, we're breaking down the high-definition science of cardiac events. And honestly, we are going to shatter some pretty dangerous Hollywood myths that might actually be clouding your judgment. We're going to map out exactly what's happening inside the body during a cardiac emergency. We're using the most up-to-date medical science to give you organized, actionable, and literally life-saving knowledge. Okay, let's dive into this. I really want you to ask yourself, do you actually know what a heart attack feels like? I mean, beyond the pop culture cliches, beyond the dramatic TV shows. If you were having one right this second, or if the person sitting next to you was, would you be absolutely certain?
Well, if you're feeling a little uneasy about that, you definitely should be. According to a pretty shocking study published in the Journal of the American Medical Association, a staggering 45% of all heart attacks are completely silent. Yes, 45%. That means nearly half of everyone who experiences a heart attack doesn't get those classic dramatic symptoms we've all been conditioned to look out for. The damage to the heart muscle, it's real and it's permanent, but the warning signs are just so subtle that they often go completely unnoticed until it's literally too late.
To make sure you're empowered with the right facts, we've structured this explainer into 5 key areas. We'll quickly cover 1. The Hollywood myth. 2. The science of referred pain. 3. Silent signs in vulnerable groups. 4. Heart attack versus cardiac arrest. And 5. Emergency steps. Let's get right into it.
Section 1. The Hollywood heart attack myth. You know the one. The dramatic movie scene where a character clutches the left side of their chest and suddenly collapses. In the real world, relying on that image is dangerously misleading.
Which brings us to Section 2, the science of referred pain.
This all comes down to a fascinating biological phenomenon called referred pain. Basically, this is when pain is felt in a completely different location than the actual site of the painful stimulus. When it comes to a heart attack, your brain literally gets confused about where the distress signal is actually originating from.
Now, what's really interesting here is the wiring of our nervous system. So when cardiac tissue is starved of oxygen because of a blocked artery, it panics, right? It fires these intense distress signals back to the spinal cord. But here's the catch. Your heart actually shares the exact same nerve pathways, specifically the T1 through T5 spinal nerves, as your jaw, your neck, your shoulders, and your arms. So when those signals hit the brain, your central nervous system essentially gets its wires crossed. It experiences crosstalk. It misinterprets the origin and just assumes the pain is coming from a familiar surface area like your arm or your jaw, instead of deep inside your chest.
And because of this crosstalk, cardiologists constantly see patients who brush off a very real heart attack as just a sore tooth, a stiff neck from sleeping in a weird position, or maybe a pulled muscle from the gym. But here's how you can actually tell the difference. Cardiac jaw or arm pain is typically a diffuse, dull ache, or this heavy, strange numbness. Crucially, if you press on your jaw or if you physically rotate your shoulder, the pain doesn't sharpen or change intensity like a normal muscle tweak or dental issue would. It just sits there. It's an unexplainable, persistent heaviness.
All right, moving on to Section 3, silent signs in vulnerable groups.
And this brilliantly illustrates a stark divide in how heart attacks actually present themselves. See, men often experience those more typical symptoms, the crushing chest pain radiating down the left arm, combined with cold sweats. But for women and the elderly, the primary symptoms are completely atypical. We're talking extreme unexplained exhaustion, shortness of breath when you haven't even been moving, persistent nausea, jaw or back pain. Very often there is absolutely zero chest pain involved. In fact, women report jaw pain at way higher rates than men do during a cardiac event.
The danger here absolutely cannot be overstated. Because these signs are so incredibly subtle, they are almost universally dismissed. Women will often write off their nausea as just bad indigestion, acid reflux, or maybe even anxiety. The elderly might just attribute that profound fatigue to getting older, or they might face communication barriers that make it hard to explain this general sense of just feeling unwell. And what does this dismissal lead to? A delayed diagnosis. And in the world of cardiology, delay is fatal.
Now for Section 4, heart attack versus cardiac arrest. The absolute easiest way to grasp this is to think of it as a plumbing versus electrical issue. A heart attack? That's a plumbing problem. An artery gets blocked, blood can't reach the heart muscle, and the tissue starts to die. The person is usually awake, and their heart is still beating, even though it's under extreme stress. Cardiac arrest, on the other hand, is an electrical problem. The word arrest literally means to stop. The heart's electrical system malfunctions, and the heart completely stops pumping blood to the brain and organs. The person drops and immediately loses consciousness.
Now, while they are entirely distinct biological events, they're intimately connected.
An untreated heart attack, that plumbing problem we just talked about, can easily trigger a dangerous arrhythmia, which then causes a sudden cardiac arrest. So treating the heart attack immediately is literally the only way to prevent the heart from stopping altogether.
Finally, Section 5, Emergency Steps to Save Lives.
First off, you really need to understand the stakes here. Medical professionals have a common saying: time is the heart muscle. There's a critical golden window of about 90 minutes for treatment. Every single minute that ticks by without restoring blood flow, approximately 2 million heart muscle cells die permanently. Let that sink in. 2 million cells gone forever every minute. You absolutely do not have time to wait and see if it passes.
Let's walk through this and build your actionable emergency response plan. Step 1. Call emergency services, like 911, first, immediately. Do not, under any circumstances, attempt to drive yourself or the patient to the hospital. Paramedics can start life-saving assessments and treatments the very second they arrive. Step 2. Have the person sit in a comfortable, semi-reclined position. This eases their breathing. Loosen any tight collars or belts. Step 3. Administer aspirin, assuming they're conscious, not allergic, and the 911 operator advises it.
So the crucial point here is exactly how you take that aspirin. Standard guidelines recommend a dose between 162 and 325 milligrams. If you're in the UK, that's a standard 300 milligram tablet. But here is the literal life-saving detail. You must chew the aspirin. Do not swallow it whole. Uncoated aspirin is best. Chewing it gets the medication into your bloodstream significantly faster, where it immediately goes to work thinning the blood and stopping platelets from forming any further clots. This one simple action can dramatically reduce the severity of the attack while you're waiting for the ambulance to arrive.
I want to leave you with a really powerful thought from the British Heart Foundation. You know, when you feel a weird ache in your jaw or this profound, unexplainable fatigue, human nature tells you not to make a fuss. You probably think, I'd feel so embarrassed if I call 911 and it turns out to just be indigestion. But I really want you to flip that thinking. Imagine how you'll feel if it actually is a heart attack, but you left it too late. There's no coming back from that. The subtle signs are there, and your nervous system is doing its absolute best to warn you. The real question is, now that you understand the science, are you ready to listen? Thank you so much for joining us for this explainer. Stay informed, stay vigilant, and please share this knowledge. It just might save a life.